Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette. Today we are announcing 5 additional health region. I want to extend my condolences. Our 10.7% provincially, 11.9:30 a.m., 118 restrictions. We're going to continue to monitor the impact of those holiday gatherings throughout this week, and we haven't yet landed on the new restrictions. Right now, we all need to continue to focus on those fundamentals to protect yourself, your loved ones, our neighbors, our co-workers, our community safe. And certainly people too are asking people to stay home as much as possible. Certainly stay home when you're sick. Go for testing when you're sick, even with mild symptoms. But very important to stay home when ill. We have yet to identify a case in Manitoba of the new variant seen in the United Kingdom. It has been found in other parts of Canada. We're advising all international travelers to be tested for COVID-19 upon arrival in Manitoba, even if they are not showing symptoms. Certainly all Manitobans who show symptoms, even mild symptoms, should go for testing. But people returning from international travel should be tested upon arrival into Manitoba, and again on day 7 upon their arrival, even if they remain asymptomatic. We're just wanting to ensure all international travelers are testing. And remember, this testing is in addition to other requirements under the Federal Quarantine Act. So international travelers are still required to quarantine for 14 days. And so this doesn't change that. This is in addition to that. Returning travelers should make an appointment with a provincial testing site or visit a drive-through test site. We're asking all these returning travelers to ensure they make the testing sites aware of their travel plans so we can monitor for positive tests and returned travelers. Just like in any situation, if someone later develops symptoms, those individuals COVID-19 have had close contact to an international as well. Possible, but donating blood is still very essential and around the holidays. So please consider booking an appointment through Canadian Blood Services to donate blood to save a life. Reminding Manitobans that our contact tracing calls may come from a local 204 number, may come from a 1-888 or a 1-855 number, because Statistics Canada, Red Cross, and automated calls are helping us do this contact tracing. So please be sure to pay particular attention to your phone calls, even if they are from a different area code. It could be public health calling you with important information. So thanks again. Happy New Year to Manitobans. And I'll pass over to Lanette.
Thank you. Happy New Year, everyone, and good afternoon. So this morning there were 340 COVID patients in our hospitals throughout the province, and this includes 245 who actively have COVID, as well as 95 who are no longer infectious with COVID but still require inpatient acute care. As of midnight, our intensive care units were at 157% of what our normal pre-COVID capacity would be, and there are 113 patients admitted to critical care. 41 of these patients have COVID or are just past their infectious period but still very sick. 30 of our 65 patients who are on ventilators this morning have COVID, and this includes 4 COVID patients who are no longer infectious. The hospitalization numbers involving patients with COVID appear to be stabilizing now with the decrease in active cases. but they still are higher than what we would normally be without COVID, and it continues to place a strain on our staffing situation and the healthcare system as a whole. Especially in the critical care areas, we are relying on that overcapacity to be the care provided by the surgical nurses, the team that works within the surgery program. So as we see the numbers come down, we are hopeful that the critical care admissions and medical admissions in hospital will also start decreasing, at which time we can talk about gradually increasing surgical procedures. As you are aware, we still are doing emergent and urgent cases, but it's our goal to start doing those elective and non-urgent cases as soon as possible, because we know people are relying and waiting for that, and quality of life is impacted without having those procedures. On the personal care home front, there have also been some stabilization happening and over the last while with a decrease. 25 of the 43 outpatient care homes throughout the province have two. There are 16 out. That reflects an incubation period that we are within Manitoba's personal care homes. There are 103 active cases involving care home residents and staff. So that's 55 active cases for residents as well as 48 active cases within staff. There still is lots of work to do on this front. We are definitely not out of the woods yet, but I did want to thank everyone who's been involved in stabilizing the personal care home situation, just through the cleaning and all the work that's been done to minimize the spread of the virus, as well as all the healthcare workers who have stepped up to support these teams, these personal care home teams. The COVID situation means that people who are in long-term care are much more, they have higher acuity needs, so we have been changing the nurse-to-patient ratio and the healthcare aide to patient or resident ratio. So it has required more resources than we previously had, and we just want to say our thanks and sincere appreciation to everyone who's been helping, and it's looking like it's working, so thank you so much. In the hospital area, Public Health is reporting that there are 15 or hospitals throughout the province, and these specialized team while they are either self-isolating or following discharge from hospital. And it is able to support people who are on oxygen as well, as that is sometimes one of the lingering effects of COVID. And a physician will monitor on a regular basis the severity of the patient's symptoms at regular intervals. And if the symptoms seem to be worsening, a paramedic may be dispatched to the patient's home or wherever they're staying, if it's an isolation center, and they can monitor vital signs, they can do blood work, and if the symptoms are severe, then we can coordinate transfer directly to the hospital or the emergency department and meet those escalating needs. So the pilot was launched 3 weeks ago, and 14 patients so far have been enrolled in this pilot project. 3 of them are active COVID cases. And when you look at what we're starting to see now is by supporting these patients in the home where they may have been in the hospital, 5 patient days, patient hospital days, closer to their familiar surroundings, the resources in the hospitals. So pilot has worked out some kinks and figured out
putting additional strain on our testing sites or the testing capacity at this point.
Okay. And with the nicer weather out, we're getting questions from people who would like your advice on mask wearing in situations where it isn't exactly mandatory. So, for instance, there's a lot of people out this weekend skating or walking trails here in the city. What would your advice for people in those situations?
Yeah, I think the advice is to wear a mask whenever possible. So it's not required in outdoor situations, but we know that putting on and taking off your mask is often a time where you put yourself at a bit of risk for inoculating yourself. So, I think hand washing, wearing good advice. And so certainly in the Winnipeg region, we're seeing cases again in the lower income quintiles, and in the Point Douglas, the downtown, the Seven Oaks regions. So still looking at approaches there. We've have some additional testing in the area, still looking at more approaches. But in Winnipeg, that's still the disproportionate effect in those regions.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin, Gavin from Radio Canada. I was just wondering about the testing for international travelers. Is this going to be obligatory and mandated by the province in a health order?
It's not in a health order. Right now, it's our messaging to people returning to Manitoba from international travel to be tested as soon as if you remain asymptomatic. Certainly anyone who, based on a balance of the highest risk settings and the ability to get the most vaccines and the most arms in the shortest period of time. So they have the algorithm in place, and as far as more specifics go, then probably Dr. Reimer will have more on Wednesday for you.
Okay, thanks. And obviously, there were no vaccinations taking place over the weekend. There has been some suggestion that we're trying to independently verify, but Manitoba is actually the worst in Canada at getting vaccines in the arms of Manitobans per dose available. What is your comment on what appears to be the slow start that we're having here in Manitoba?
Well, our rate limiting step is the vaccine we have on hand. So as we receive vaccine, we're on administering nearly 7. If we did that 7 days a week, we'd still have just specifically as we amend these next orders.
And the NHL bubble plan was different in the spring. It seemed to be very successful, especially compared to other Major League sports that had travel. What might be in place if this plan is approved and goes ahead? What might be in place to protect frontline workers, hotel workers, restaurant workers, people who might come in contact with the players and might be that link between whatever bubble might exist and the outside world?
Yeah, so there is a very robust plan in place that we reviewed at each provincial level as well as nationally. So the plans are quite robust. They include very frequent testing. This is changing daily.
Okay, and also there were still about 2,000 open vaccine appointments for people who are eligible. Is there any update as to how many of those remain open?
I don't have an update at this point. I think there'll be a memo, a bulletin released later today about 3.
From City News, Mark.
Good afternoon. Going back to looking at Manitoba provincially in terms of how we are doing getting the vaccine into the arms of our citizens, I'm wondering if you can just clear up how many vaccines we have on hand and how many we have administered so far.
Yeah, I don't have the details. Roughly 3,400 doses. We're looking at
outdoors.
Can you explain a little bit more about what is and isn't allowed and who's responsible to monitor that group sizes remain small?
Yeah, and so right now our group sizes, both indoor and outdoor, are 5. And so that means the groups are really people who have come with the same intention to gather. So we may be could be at a rink, and you're there with 3 or 4 of your friends, and somebody else is there with 3 or 4 of your friends with no intent on gathering together. Then that can certainly occur, and can extrapolate that to any settings. We just want to avoid the large group sizes all together, spending a lot of time even outside. As far as who's responsible, it depends on the situation. So I think there's who has a venue that's outdoors to ensure that
as necessary.
Okay. We heard a bit about the asymptomatic testing pilot project in those 3 personal care homes. Can you provide an update on that project, and can you say whether asymptomatic testing will be expanded in the province?
Yeah, I do have the last update I have is as of December 30th. So the 3 sites, there was a total of 511 asymptomatic testing provided to the staff. 86 at Country Meadows, 296 at Deer Lodge, and 1 at Donwood Manor. And the positivity number of positive cases remains the same as it was previously. Just 1 has been identified. So yes, we had said that was going to be
of trying to reach eligible people in. We know that in any vaccine program, there's going to be some doses that go unused, and so far this has been very small as far as vaccine programs go. And so there's a lot of planning that goes in to ensure we're effectively using as many doses as we can and getting those doses out as quick as possible.
From the Brandon Sun, Michelle.
Good afternoon. First question, are you or will you be tracking the refusal rate for this specific vaccine in the province? And what do you now know about that?
A refusal rate, any stance right now to make that a reportable issue.
From CBC National News, Cameron.
Good afternoon. Happy New Year, everyone. Just question, just kind of checking back in. Dr. Roussin mentioned earlier in the call about, expecting phone calls from other area codes for people that are being contact traced. As for people that have a positive test and are at home, should they still be expecting a phone call from to basically check in on a daily basis, or have we gone past that now?
Yeah, well, we still do active monitoring. It's not necessarily every day, but we do monitor both cases and contact. Also to ensure that they're maintaining that active monitoring that takes place. That's contravening our public health order, and so I'd suggest people limit their group sizes.
Dr. Roussin, do you know when we will get the new public health orders, so when people can look over them and provide feedback to the province? Is there a point this week when people should be expecting those?
Well, I mean, I think it's going to be this week. They expire on the 8th, and so we'll have to have the orders in place for the 9th. So, but I can't give you a specific timeline on that. Being shipped to us.
Time for one more question.
Dr. Roussin, are you aware of anyone getting the COVID vaccine who doesn't fall into the prescribed criteria, whether that's unintentionally or otherwise?
I'm not aware of any specific situations like that, no.
Thank you.